Hey guys.
Hey guys.
Okay, so for today's video guys, let's talk about some informative topics, since we have been getting comments about it and emails about it, about having an insurance in the Philippines, health insurance in the Philippines.
Right.
So for expats or for foreigners that wants to plan about moving to the Philippines or relocating here for good, and what kind of do we have insurance, and maybe you can start and explaining.
Well, I would start. I'll start off with no. I don't have health insurance, and the reason being is they want to exclude everything that's wrong with you.
Right.
Well, so all your past medical history, they want to exclude that from the policy. Well, unless I die of a hangnail, there's no point in me, getting insurance, man. They're going to exclude everything that's wrong with me.
Right.
And plus, at my age, even if they did insure me, it'd be so expensive, it'd be ridiculous.
It is very expensive.
Yeah, so, we're kind of self-insured. Hopefully we'll have enough money when there's something major comes up, but...
Which last month, that's what happened.
Yeah,
he was
month.
hospitalized, and thank goodness we were managed to pay for it, because we had to pay cash for it. We don't have health insurance, so...
Yeah, that hospital saved my life. I know they did. I mean, I don't think I was going to make it, man. But without that...
Actually, there were a couple of health insurance companies that the doctor mentioned. I just cannot think about it right now.
Yeah, he said, when we were
mentioned,
talking to the doctor, he mentioned, you need to have health insurance. And I said, well, yeah, if I could find one that would insure me. And he named off a couple of health insurance companies here. And I go, well, given my history of all these heart attacks and pneumonia and COVID and everything else, do you think one of them would insure me? And he goes, well, probably not. Well, there, you answered your own question.
All right, go ahead, honey.
Yeah, so I know you could get, and we could get into PhilHealth. You get that pays a little bit. Even if you go to a private hospital, I think it pays a little bit. But the things, I haven't checked it out myself, but I've talked to other people and read other things about it. You have to go to a provider in their system, just like any other insurance. And you have to go to a hospital that's in their system, or they don't pay. So that's kind of inconvenient. Unless who knows if there's a hospital or a provider in our area. Yeah, you only get what you pay for. I mean, I think it's like $300 a year for the spouse of a Philippine citizen. But that $300 doesn't get you much coverage. So obviously, the higher coverage you want, the more you got to pay.
Right.
There's no bargains out there, as far as I know, in the healthcare industry. It's
PhilHealth, actually, it's also an insurance for people who cannot afford it. Those people that doesn't have enough income. And the thing about it, they will only let you apply if you are already hospitalized.
Right.
Like, you are currently in the hospital and they give you the bill, then you can go to PhilHealth, then you can apply for it. I went there once in their PhilHealth office here in our town, Nabunturan. My husband is a foreigner, and how old he is, what are his health issues, or your history. No. So we just here.
So they know what to exclude you from.
Right.
Go ahead.
Yeah. So the more you put your, like for example, Dennis had 3 heart attacks. Unless you lied, but you can't lie. You have to tell the truth. Yeah. Oh yeah, he had this, he had that. So the more of your health issues and your age, the higher you have to pay, and it's almost like it's better that you have to insure yourself, because if we pay that much amount, we were thinking it's not worth it. We're gonna pay half of our income for just for insurance. Yeah.
For instance, PhilHealth, for them to pay 100% of the bill, you got to go to a public hospital, and use a certain doctor. Well, what if you have to have a stent put in? You can't go to a public hospital and get a surgeon that's going to put a stent in.
Well, there are some public hospitals.
Well, I'm sure there are if you want to take your chances. But,
Yeah.
you know, most people, especially foreigners, want to go to a private hospital. The PhilHealth, if that private hospital is in their list, on their list, PhilHealth may pay 20%, something like that. I don't know.
25%.
25%, but
And-
you
yeah.
have to go to a hospital and they, okay.
Yeah, that is why we decided that we're not gonna go for it, or we're not gonna take it, because they will cover not even 50%, and you're paying a month, and I don't know, we just thought that it's better to, self-insured.
Yeah, health insurance is, to me, you know, maybe this is my biased opinion, health insurance to me is one of the biggest scams there is. I mean, you know, you need an issue, especially in the U.S. I don't know too much about health insurance in the Philippines, if they operate the same way, but if they operate the same way the U.S. does, it's terrible. It should be illegal, you know. But so anyway, all of that, we try to save money to be self-insured, because we're going to approve the procedure that needs to be done. We're not going to, you know, like insurance companies, they'll stall. So, you know, that's, and plus, if you want to find out the real story about health insurance, don't ask somebody. Call one of the
Research.
insurance companies and ask them the questions. And you can Google it up and find out who provides health insurance in the Philippines. I know there's Blue Shield. Is it Blue? It's not Blue Cross. Yeah, and Pacific Cross, I think, something like that.
I don't know.
There's a couple of them here, but I know there's more than two here. The doctor gave me a list about 2 or 3, and I can't remember the names.
He didn't give the list, and he just
named them off,
mentioned it. Yeah.
But I can't remember the names. So
I am sure that some foreigners that wanted to have insurance, they can get it, especially if maybe they didn't have a health condition or health issues, and
if you don't have any pre-existing conditions,
right,
and you're pretty
a
young,
little young,
nothing's going to happen to you, they'll insure you all day long.
Yeah, but for Dennis' case, his age and all his pre-existing conditions, it's so hard.
They won't even insure me.
It is possible you can get it, but then what? You're gonna use all your income to pay for the insurance company?
Right.
No.
And you know, I can't give you a price because it all depends on your age, your health history, you know, and who you're going to insure. There's no way I could give you a ballpark price.
Right.
So you're better off contacting one of those companies and you know, talking to them, and maybe they can do that.
Yeah, so for those who are asking us about is there health insurance in the Philippines, or how much does it cost, we shared with you guys that Dennis doesn't have health insurance. He's self-insured, and if he would like to get a healthcare insurance, it's impossible to afford it.
Yeah, I can't give you a quote from some insurance company that I don't represent. I mean, I've seen some other vloggers that do that, talk about health insurance and say, oh, I've got a friend that only pays this much a month. Well, that may be true, but what's his conditions? How old is he? Blah, blah, blah. You know,
And how much does it cover? Does it cover 100% or only 50% or only 25%? It depends.
You want $10,000 worth of coverage or $100,000 worth of coverage?
Yeah. The higher the coverage, the higher your payment is.
Yeah, so.
For sure.
And if you're relatively healthy, you're throwing away money every month.
Right.
That you're not going to use.
Yeah.
But anyway, here and you know, medical care here is pretty reasonable. It's pretty cheap compared to other places, and you know, if you find the right hospital, like the one we found, is very reasonable. It's Catholic Dennis-owned hospital, so it's very reasonable.
Yeah.
And they have a good staff there, and so we found it fine.
Yeah, that was the first time that Dennis hospitalized here in the Philippines.
Yeah.
So now he know that actually being hospitalized here in the Philippines not bad, because
No, I got great care, yeah.
I don't know, in some other places it depends on what hospital you go to, but for Dennis, he can't complain about how they care for him, because they really keep checking on him.
They sure did.
It was a private hospital, and I would say, and this is the truth, that if you go to a public or private, there is a big difference.
Big difference, yeah.
Although the private is a lot more expensive, but yeah,
It's still
you
cheap
get
compared.
Oh yeah, you get a better care.
Yeah.
Because the public hospitals, they are so busy. There's so much patients that the nurses cannot take care of you all. The doctors are so busy.
The facilities are kind of run down.
Right.
The equipment is not top of the line equipment. I mean, they're struggling.
Right.
Yeah, that's about our story on healthcare, as much as we can tell, because we don't have health insurance. Either one of us. Now, if something happens to Marissa, she can go in and get PhilHealth, no problem. She's dual citizenship. She's still a Philippine citizen. And with a U.S. citizen.
Yeah, but like I said, I can get a health insurance because I'm younger anyway. They will insure me. I can't get it for free because they will ask you what's your household income. So of course you have to tell them, and you have to make a payment, because if they call it here indigenous there's a term for it.
Indigenous insurance.
Yeah, indigenous insurance, that if you don't have enough income, like Mylene, when she gave birth, they applied for it on PhilHealth, so she paid zero, except that a couple of medications that they had to get at the pharmacy. But then the beds and all, it was covered by PhilHealth because they didn't have enough income, So, but then for me, I would make a monthly payment. And
last time we talked about this, we had a couple of people. One guy got on and said, "Oh, that's ridiculous. You could get PhilHealth, and it's only $300 a year for the spouse, and blah 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 blah." Well, that may be true to a point. I mean, you get coverage for $300, but how much coverage? And the more coverage you think you need, then the more you're going to pay for it.
Yeah.
So the best thing to do is check it out yourself.
Right. Yeah, because I asked them, what if you get hospitalized in a private hospital? They don't cover as much, because it's like they're saying that if you cannot afford it, why would you go to the private then? So go to the public hospital if you cannot afford it.
You can buy international insurance, and just make sure it's good in the Philippines, accepted here in the Philippines.
But imagine how much that would be having
it's not going to be cheap.
International insurance. So here in the Philippines, a lot of the foreigners, I would not say it's all, but a lot of the foreigners moved here so they can budget their money, and we are one of those couples that moved here to the Philippines because it's hard to afford the life there in the U.S. And, with our situation there,
we'd be better off financially moving here, which is a good move for us.
Right.
It worked out, but that's about it. The deal on health insurance.
Yep. And
it could be more helpful, but I'd say Google the insurance companies and give one of them a call.
Yeah, and we just shared with you guys the experience that we have in here, and with Dennis hospitalization. So, and you said you.
There was another question. I got a couple of times, and one of them was last week here. He asked, "What was the hardest part of retiring, and especially retiring in the Philippines? What was the hardest part about it?" I think the hardest part about retiring, at least here in the Philippines, was all of a sudden not having anything to do. All of a sudden, because you go to work every day your whole life, and pretty soon you retire and you think, what do I do now? But it was hard to get used to that. It was hard to get into relaxation mode, and that took a long time. You know, that took a long time. It seemed like there was, when we first got here, there was always something I was, wanting to do, but didn't quite know what it was.
I remember that, and I keep saying, "You're in a hurry.
Yeah.
Oh, you need to do this right now. This, like right away." And he goes, "Oh, I'm just used to doing something." Like when we were in the U.S., when Dennis doesn't have nothing to do, he would go to the garage, do something, or go to the storage and find something to do, because he had all his tools in there, and he can just figure out what he wants to do. And here we don't have he don't have all that tools anymore, so it was hard for him at first, but eventually he got adjusted, and now we are just grateful that whenever he feels so bored here at home, we could just go take a ride somewhere.
But the second thing that was tough, retiring, especially in the Philippines, coming from another country, is the food situation. So, I'm not a big fan of Filipino food. Don't get me wrong, it's fine for Filipinos. They grew up eating it, and I understand that. But
although there's a couple of Filipino food that you like. There are a couple of dishes I like,
so when we first got here, we'd go to the local supermarket, and I couldn't find, there was nothing I could find. I could find a little can of Hunt's pork and beans and Lay's potato chips, and that's just about what I lived on.
Yeah.
For the first few months we were here is
that's all
pork and beans and
a toast.
Potato chips. And
that's
toast.
That's what you ate before, and make eggs. That's about it.
I didn't have any weight problem then. I was pretty skinny.
Eventually, he slowly discovered all this food.
Well,
all
we found the American section in the Grand Mall, and then that led to us going to Tagum and going to G Mall and finding, oh man, they had all kinds of Western food in there.
I don't know if it was really a good thing that you found it or bad thing, because it's good thing that you found it, something that you like, but it's probably a bad thing also, because then all the carbs, all the sweets, and
it wasn't good food that I was consuming. Western food is,
I don't even want to think about all that sweets that you have been eating for I don't know how many years. Like,
I'm back to basics now. So.
Well, you're still eating good food, honey. You eat fish, you eat chicken breast, and good cut of pork chop.
Yeah, I'm eating good. I'm eating good now, but that was when we first moved here. That was the tough part.
Yeah.
Besides adjusting to the weather, adjusting to the customs that were different.
There's a lot of adjustments.
So when you retire to a foreign country, there's a lot more things to adjust to than as if you retire in your home country.
Right.
Culture, weather, everything else.
I don't think you have actually adjusted to the weather yet.
No, the heat still gets me.
Yeah, you still complain about the heat. Yeah, I had a friend before that her husband, they moved here in the Philippines, they didn't even have AC. They have an electric fan, and no wonder her husband couldn't take it, and they had to go back to the US.
Yeah, well, there you go. I knew when we moved here, I was going to have to be comfortable here in order to make it. So that's why right off the bat got a recliner, AC for the bedroom, a good TV, and
I did all of that, honey.
Yeah, I know.
Yeah, before we moved here, because I surprised you with the house, so I know that in order for you to be comfortable or livable enough, the house, I know I had to get an AC, TV, and a shower.
Yeah, hot shower.
Yeah, hot shower. The rest of the house was not even finished yet, so You know,
We didn't have flooring in or nothing.
no tiles on the floor yet. There's a rough cement, but that's it.
We had the wrong kind of windows in, no screens on, so
Yeah.
mosquitoes were an issue.
Yeah. But the important thing that I really made sure the room was all nice, it's all painted.
Yeah, right.
You know, and then there's a flushing toilet, and like I said, hot shower.
Yeah.
You know, so yeah, you got all you need. You
Yeah,
know,
so
and
retired to a foreign country, I'd say it's the food, the weather, the customs. Not necessarily in that order. Customs might be the customs here might be a bigger issue. I think it was longer for me to get adjusted to the customs here than anything else.
Yeah.
Why did you do this? Why did they do that? You know.
Just like when I first went to the US, I have so many questions. Oh, this is how they do it. This is their culture is about. Oh, blah, blah. It's all about adjusting how the people are, how their systems and weather. Yeah.
I'm sure it depends on what industry you come from. You know, the building industry, what I was in, it was always high pressure, man. Hurry up and perform, build it fast, build it good. You know, hurry. And doing that for 35 years, all of a sudden you're retired and time to relax. Pretty hard to wind down.
Yeah.
But, managed to a little bit.
So hopefully guys, I don't know, I cannot say that this video is helping you about the insurance, but we are just sharing with you.
We can only answer the questions that we've experienced. We haven't experienced health insurance.
Yeah.
We know a little bit about it, but not all the details, how much it costs, but it is available.
Yeah. So, is anything else, honey, that you wanna add?
Go ahead.
Well, I guess that's it about the health insurance and how retiring in the Philippines, how Dennis adjusted to
Hope
it.
this helped answer some questions.
Yeah.
Hope so.
So if you have any more questions, guys, just comment and
We're going to start. We've started trying to answer some of the comments.
we did yesterday. Maybe we're gonna
how
answer.
consistent we're going to be about it, but
Maybe we're actually gonna answer a couple of our videos or comments like after this.
yeah.
So thank you very much for watching this video and see you soon.
Thanks for watching, guys.
Thank you
Appreciate it.
guys.
Bye-bye.
Bye.